We're just overwhelmed with the level of care that we've had. It's just been amazing.
The care that I received and that Tess received was second to none, so I tell everybody that they should come here and have their babies here.
Hello and welcome to Ormskirk Maternity Unit. This virtual tour will show you the excellent facilities that we have to offer to mothers, their families who are choosing to have their babies with us. It's an exciting time having a new baby, and like all mothers-to-be, I'm sure you've got plenty of questions, and we hope that this video will help to answer some of those.
When you've had a positive pregnancy test, you can directly self-refer into our maternity services. This is a rapid way to gain an appointment. Alternatively, you can visit your GP. We also have an early pregnancy assessment unit, which is a specialist midwife-led service from 5 to 16 weeks gestation, whose aim is to offer support and choices for women with early pregnancy concerns. Once we have received your referral, we will either do a booking with you in the antenatal clinic or with the community midwives. We will take a detailed history about you and your family's health, discuss antenatal blood screening and take some blood samples. At this appointment, we will discuss your choices for having your baby at hospital or at home. Whatever you decide, we will try our very best to make your pregnancy journey what you want it to be. We have 2 teams of community midwives, one for Ormskirk Hospital and one for Southport Hospital. We work closely with your GP practice, and each GP practice has its own designated midwife. This midwife attends your GP practice once a week on a set day, and she will become your named midwife. She will provide your antenatal care throughout your pregnancy. If you are having consultant-led care, you will still be seen by your community midwife. We provide parent education classes at both Southport and Ormskirk hospitals to help you prepare for your labour and birth. These are either Saturday daytime or midweek evenings. In addition, we also provide aquanatal classes which help prepare your body for labour. These are held in Southport, Ormskirk and Skelmersdale. Once you've had your baby, we will come and visit you at home. We'll provide you with all the advice, support and information which are vital in the first important weeks.
Welcome to the antenatal clinic. Our main provision is at the Ormskirk Hospital, although we have clinics both at the Southport hospitals and Ormskirk. At Southport we have an ultrasound scan list each weekday morning and all day Wednesdays. You will see a midwife following your scan who will explain it to you and answer any questions that you may have. We also have a consultant clinic once a week. At Ormskirk Antenatal Clinic we have ultrasound scans each weekday from 9 to 5. If you're having consultant-led care, there are clinics held throughout the week. We also have a number of specialist clinics that you can find more information about on our webpage. The antenatal clinic is a family-friendly area where you're welcome to feed your baby, and we also have a children's play area. From both hospitals, we have close links with your community midwife in whichever area you live.
Making the decision on how to feed your baby is really important. Here at Ormskirk Maternity, we are actively engaged in the UNICEF Baby Friendly accreditation process. These baby friendly standards help the maternity and neonatal staff give you the best breastfeeding advice and support. Because of the great health benefits for both mother and baby, breastfeeding or giving breast milk is the healthiest way for a mother to feed her baby. Having as much information about your feeding choices will help you decide. If you're having twins or more, your choices are just the same. Our parent education classes and infant feeding workshop can help give you that information. Your community midwife will be able to help you with this. Whatever your feeding choices, we will offer you as much support as we can to help you feed your baby safely. This will enable you to respond to their needs for feeding, closeness and comfort.
Ormskirk Hospital is situated on Wigan Road and has ample car parking, including family-friendly and disabled parking areas. We can cater for visitors in wheelchairs and we have great accessibility at this site. The maternity unit has its own entrance which is reached by driving past the main entrance and following the road round. Cars can be left here for a few minutes only while dropping off or collecting. Outside normal hours, the door will be closed, so simply press the button and we will let you in. Take the patient lift to the 4th floor. Turn right out of the lift and come to the maternity assessment unit. Again, press the buzzer and we'll let you in. We are fully accessible with wide doors and lifts to all floors. Welcome to the maternity assessment unit. We are on level 4 next door to delivery suite. We have 3 units working alongside each other here. We have the triage, pregnancy assessment unit and the induction bay.
Hello, can I help you?
Our triage system operates 24 hours a day, 7 days a week. If you have any worries or concerns during your pregnancy or you're in labour, give one of our midwives a call. They will reassure you and go over any concerns that you may have over the telephone, and we may invite you in to be seen by one of ourselves. The pregnancy assessment unit is open 7 days a week, and we operate an appointment system on this part of the unit. If you're coming in for things such as glucose tolerance tests or pre-operative appointments or regular fetal monitoring, it is one of our midwives that will see you on this unit. If you are coming in to have your labour induced, we have a 5-bedded induction bay. On here, we will look after you and reassure you until you are ready to be transferred to delivery suite.
When the time comes for you to have your baby, you will be welcomed onto the delivery suite by our experienced and caring team. You will be shown to your own room and introduced to a midwife who will provide one-to-one care throughout your labour and delivery. This is the time when you can talk with the midwife about your birth plan. On delivery suite, we have 8 rooms. All rooms are equipped to ensure that your needs are met. Our delivery rooms are specifically set up to encourage active birth. One room has a fixed birthing pool, and we also have an inflatable pool which can be accommodated in most of the other rooms. You may wish to bring your own inflatable pool, and if you do, we will provide everything else that you need. We will also assist you with setting it up. We want you to feel safe, comfortable and cared for during your time with us. We have a variety of equipment available to assist and encourage you to remain active during your labour. We also have audio equipment in all of the rooms, so you may wish to bring some music with you that you find relaxing. There are different choices of pain relief when you have your baby. These start from breathing techniques, massage and the use of a birthing pool. If you choose to hire a TENS machine, you can bring this with you also. There are other methods of pain relief like Entonox, which is also known as gas and air, paracetamol and codeine, pain relieving injections and an epidural which is available 24 hours a day.
Whilst most women will have an uncomplicated pregnancy and delivery, some will require the support of our medical team. This may be because of pre-existing medical conditions, problems experienced in previous pregnancies, or complications that arise in this current pregnancy or delivery. We support and encourage high-risk women to achieve a normal birth when it is safe to do so, and we aim to provide individualised care according to the wishes of the woman and her family. It may still be possible for high-risk women to use our birthing pool for either labour or delivery, and you can discuss this with your obstetrician. For women that require continuous fetal heart rate monitoring but wish to remain active or use the pool, we can use telemetry, which is a remote system that permits wireless monitoring. Some women may require assistance for delivery. We may use a ventouse, sometimes known as a suction cup, or forceps. These types of delivery are usually performed in the delivery rooms. Occasionally we need to perform this type of delivery in theatre, and so we have a dedicated obstetric theatre within the delivery suite. This is also where caesarean sections take place. Whatever type of delivery you have, we will still aim to provide skin-to-skin contact if this is what you wish, and we'll aim to involve your birth partners as much as possible.
We realise that the birth of your baby is a special time for you and your family. We welcome anyone that you wish to have during your labour and delivery.
The birth, just all the way through, just kept me positive, and we all felt really secure.
Fantastic, yeah.
Adam was involved all the way through.
As soon as your baby is born, we encourage you to spend time with your baby in skin-to-skin contact. This is time to get to know each other. It is the beginning of your special relationship with your new baby. It is during this time that we will support you in getting your feeding off to a good start.
I definitely felt safe and cared for, and the midwives were so supportive, and although I was nervous beforehand, I just felt really in good hands during my labour.
After the baby is born, we also welcome a short visit from grandparents to share this special time with you. If you and your baby are well following the birth, you may wish to discuss an early discharge home with your midwife. If you're not being discharged home from the delivery suite, you'll be transferred with your baby to our maternity ward for your ongoing care. Once you've been transferred from the delivery suite, you'll be cared for on the maternity ward. It is a comfortable environment where you'll be able to rest following the birth of your baby. While you are here, you will be given assistance with feeding and bathing your baby and generally getting to know each other. Midwives, maternity support workers and healthcare assistants are available on the ward 24 hours a day. During your stay, your baby will be seen by a paediatrician or midwife for a first newborn examination, and the hearing screening team will perform a hearing test on your baby too. Baby security is very important to us, and your baby will have an electronic security tag around the ankle at all times while they are on the maternity ward until they go home. If it comes off, please let a member of staff know. Access to the ward is controlled by an entry buzzer for your safety. Visitors are welcome, but we do have specified visiting times for family and friends to come and visit you and your baby. Once you are well enough to go home, you will be discharged to your community midwives. It is important that your baby is feeding well before you go home. When going home with your baby, we strongly recommend that your baby is taken in a car seat.
We will discharge you into the care of the community midwife who will come and visit you in your own home. This is usually the next day, just to check that you and your baby are well and answer any concerns you may have. And of course, we are at the end of the phone if you have any questions in the first few days. So now that you've had a look around our maternity unit at Ormskirk Hospital, we hope we've answered some of your questions and helped you feel a little bit more prepared for the birth of your baby. If you are coming to have your baby here, we look forward to seeing you soon. Goodbye.
Although I was really anxious before having Tess, everybody put me at ease, and although it was hard work, I felt in safe hands.
I cannot thank Ormskirk enough. They've just gone above and beyond every level of care.